My name's Akash.
I'm Juwan.
And we're going to be talking about the placebo effect, specifically how our mind is related to the effects of food.
Okay, so first, what is placebo? So placebo is substance, treatment, or procedure that has no active therapeutic effect that we know of, but but still produce real physiological or psychological benefits due to the expectation of improvement. So the key aspects of placebo is one, placebo effect, and that is when you experience symptom relief or improvement despite receiving an inactive treatment purely due to the belief in efficacy. And placebo in clinical trials is what we use as a control. And placebo response is the combination of psychological and biological response that contribute to symptom improvement. And nocebo, we mentioned in class about placebo, is the negative effect where when you expect something negative to happen, it actually does produce those symptoms. So examples of placebos would be like sugar pills labeled as painkillers or saline injections that you think is medication.
So there were 5 studies that we found. There were a lot, but there were 5 that we thought were particularly interesting. One was called Mind Over Milkshake. So this was an experiment. You're familiar with it? Yeah. So this was an experiment, for those of you who aren't familiar, where they got the same shake, both groups, and it was 300 calories. But one group was told that it was a 140 calorie health shake, and the other group was told that it was a 620 calorie dessert shake. And this is the labeling that they were given. So this is the guilt-free Sensa shake, and it's 140 calories, and then this is the indulgent shake. And what they did is they measured ghrelin levels. I apologize, it's blurry. This was the clearest image I could find. And so this is when they first saw the label. So they had similar ghrelin levels, and then this was when, at the 60-minute time point, they actually drank the milkshake. And then at 90 minutes, you can see what happens is that with the indulgent shake, their ghrelin levels went higher at first because they were preparing for this larger meal, and then dropped more after. So they were more full after the meal because they thought that it was this 620 calorie indulgent shake, which was really interesting because they both got the same shake. So again, highlighting the very interesting interplay between the mind and the body. So the second study that I want to cover was the nocebo effect, specifically in non-celiac gluten sensitivity. Do you guys remember what that is? Dr. Rebo talked about it a little. So it's basically people who don't have celiac disease, but they respond to gluten with certain symptoms, and then when they remove gluten, they feel better. So it's really poorly understood. And so how we've studied it is by doing a randomized control trial where it's blinded, it's double blind, and so what we've noticed is that about 40% of people have a nocebo effect. So when they think they're getting gluten, but they're actually not, they have symptoms. And so it's one of the factors. There's also a lot of complexity in terms of overlap with other diagnoses where it might not actually be gluten. It could be the vehicle that the gluten's delivered in, but in roughly 40% of people, there's a nocebo effect. So this is another example where the mind has a connection with the body when you're eating food.
And then I'll be talking about the placebo effect of organic food. So this is when food has organic label. And so what they did is, there were 2 groups with identical samples of yogurt, cookies, and chips, and one was labeled organic and the other was regular. So those who had the organic version, they rated the food as tastier, lower in calories, more nutritious, despite there being actually no difference. And they were also more willing to pay a higher price for the organic versions. And so the takeaway is the halo effect of organic labels influences perceived taste and health benefits. And I wanted to bring up an excellent example. I don't know, have any of you guys heard of Erewhon? Mm-hmm. Okay. So I'm from LA, and Erewhon is a famous grocery store. There's a bunch of them in LA, and it's where influencers and celebrities go to, like the Kardashians, Hailey Bieber, and they are known for selling ridiculously priced items. One being ice cubes that are $32. Their smoothies go for minimum $20, and some of them are like $50, $100. They have all sorts of supplements that are crazy prices, and water costs like $30 for a bottle. So, and there was a New York Times article about how Erewhon became LA's hottest hangout for celebrities and influencers. So it's just so funny because I have many friends who love Erewhon, and people love going to Erewhon, and it really, this ice cube is probably the same water, but because it's sold at Erewhon, people are willing to pay $30 or more for it. So this is a study in real life. And the second one is about the decaf energy drink experiment. And this was a study done to undergraduate students who were unknowingly given decaf beverages but told it contained caffeine. So they used this New York Minute, which is an energy drink. And so all the drinks had this label, and some people drank the actual one, and then the other people had one that tasted like it but was a placebo drink. And they had water. So the placebo effect of people having more energy manifested only for consumers who desire the arousing effects of an energy drink, and they experience identical physiological and subjective behavioral changes as those who actually consume energy drink. And so this shows that expectations can drive physiological changes even when consuming caffeine-free beverages. So in medical school, there's a lot of people who drink caffeine, but maybe you can just drink water and tell yourself it's caffeine and have the same effect. So yes.
And then the last study was this one where they, you flip to the next slide, basically gave people the same drink and they gave them the nutrition labels. And so one group got the low sugar nutrition label, one showed that it was high sugar, 30 grams of added sugar, and this was the actual nutrition label, so it was in the middle. And so what happened, interestingly, with their blood glucose levels was that the perceived high sugar group actually had lower blood glucose levels, and so they think that that perception of being that they were about to drink a high sugar drink, they released more insulin, which is really interesting. And so there were a lot of studies like this. I mean, we found a lot that were really interesting. There was one where they gave people something non-alcoholic and they started acting drunk because they told them it was alcoholic. So definitely a huge connection between like our perceptions and the body and the mind. And so, highlighting some of these studies, we just wanted to move into a little bit of a discussion. How can we translate this information to patient care, that there is this connection between how we perceive the things that go into our body? And I wanted to open up to you guys if you had any ideas.
I think we've talked about this week how impactful the mind is in terms of like cancer treatments. And so sometimes a part of it is manifesting or wanting something to go well, and just having that thought sort of boosts the effect of the drug or the therapy.
Yeah, I love that idea of harnessing the placebo effect because it's something so powerful, but it's something that in research we try to minimize, but we should really try to harness it in patient care. Any other ideas?
I think also just communicating with patients about the importance of self-love or compassion, because sometimes I know a lot of people that struggle with food addiction will eat something and, oh my God, this was so fattening, so sweet, start automatically going down a negative spiral. So communicating with them, your mind has a big role. How can we change how you think and how you talk to yourself and how that can influence your health?
Yeah, absolutely, and that's something that we talked about was, not that there was specific research on that, but just for discussion's sake, tying it into disordered eating patterns, right? If you're overly restrictive or you see certain foods as a cheat meal per se, it definitely changes how you perceive it versus hey, I eat pretty healthy overall and this is a comfort food that brings me joy. Will it have a different effect? And so that's something that we think really ties into that dietary counseling component.
And I was just talking to a cardiologist today for a study that we want to do, and she did a self-belief questionnaire that she gives about what people think about what they're doing. And so some patients think that eating meat at every meal is actually beneficial, and if they don't feel well. So it's maybe changing perceptions, and so then how do you feel afterwards, and when you don't eat meat versus when you do, and stuff like that. I think that would probably be good, because I think what drives people to do these unhealthy behaviors, a lot of it's deep-seated from families and cultures. The other thing I wanted to say is that the really cool thing about placebo to me is that it just shows how our body is built to self-heal if we just let it, So
that was definitely another takeaway that we had as well. Any other comments, questions?
I think also, I wonder how much you could use this in just in general pain management. You know, we talk about with fibromyalgia or people with, you obviously don't want to like be giving them sugar pill, like just
Yeah.
giving them like sham pills all the time, but I wonder if there's a way to give them a sugar pill or like,
Yeah.
if it, in a way it's more just helping them along.
Although Dr. Spurtis like highlighted that in IBS patients, even when they were told it was
Yeah.
placebo, it still had a beneficial effect. So you don't have to feel like you're doing something unethical or gaslighting them.
Yeah.
But yeah, we just thought that this was really interesting, and like there was a decent amount of research highlighting this connection between the body and the mind, how we perceive food, and we think it could tie well into certain considerations with dietary counseling. I like how you brought up like a lot of these deep-seated things with culture, and I've come across patients where like they might know a certain food is healthy, but they're just terrified of it because of what their mom told them, which was incorrect, like growing up, and they just can't bring themselves to eat that food. So, yeah. Any other comments, questions?